Hi, my name's Elisa. We're back and we are talking about the reproductive system, the female element, and this time we're going to talk about the uterine tubes, formerly known as the fallopian tubes. Right, so the uterine tube, also known as the oviduct, right, like because it's a duct and the ova go through it. Formerly also as the fallopian tube, a little bit more. Actually, that's how I learned it, as the fallopian tube. The canal is about 10 centimeters long and it goes from the ovary all the way down to the uterus. And it's muscular. It's lined with ciliated cells. And they are going to be folded quite a bit into these longitudinal ridges, and they are going to help guide uh, the ova down to the uterus, and also this is the site often of fertilization in humans. The female reproductive tract is as such. So we talked about some of these earlier, but this is just a different view of just more specifically here the uterus, the ovaries, the vagina, and definitely the ligaments. So let's talk about those. Infundibulum, right? You've heard about this in other parts of the body, is essentially like a connective component. It is the associative part of an organ that bridges two structures. Um, let's see here. The ampulla is where we are. This is the primary component, like the first part after the infundibulum, right? That the ova will travel down all the way to the isthmus, or the smallest of the openings of the smallest part. I'm sorry, the least circumferential. There it is, of um, the uterine tube before it enters into the uterus proper. So the uterus has a couple parts to it we should talk about. Um, so the fundus is usually the top. It's like the curvature right here. The body itself. Let's see here. Let's talk about ovarian ligament, right? Quite like here it is, kind of coming in right here, ovarian ligament, and it's closely associated in this point to the round ligament and the broad ligament. The broad ligament, as you could guess, is this like kind of largish white, like plain ligament itself, and then of course the round ligament coming right off, cardinal ligament with vasculature as well. So um, I know this seems overkill when you look at it in this little tiny, not pregnant with a 9-month-old fetus baby, but they are incredibly important for positioning and stability within the body. So later on, they become incredibly important as everything bends and stretches. And it is important now for keeping it in position. But just thought I should address that. A lot of people are like, why are there so many? And it's like, it's got to be flexible but stable. So there's this. Let's talk about the layers of the uterus, which we'll get into a little bit more. Endometrium. Endo always means like inside, right? So this is the inside part. The myometrium, myo meaning muscle, is the muscular layer, right? Nice thick layer. And then the perimetrium is like on the outside. It's where all the blood vessels are going to enter into. It's the external surface, the perimetrium, right, of the uterus. So cervical canal also. So the uterus is going to, it has this like broad opening in space. It will have a narrow wing as it comes to meet the vagina and the cervix. So the cervical canal is that like kind of like a small entry point, I guess you would say, for the semen, or a small point for a fetus that is about to be born, about to be a baby. So the cervix itself is that transitional point between the vagina and the uterus. It's also the site of the mucus plug during pregnancy. Right, here's the external OS. External os, sorry, so the vagina, here's the vaginal rugae, as you can imagine, so all the ridging, right? Let's see here, cervical canal. Lateral fornix goes up and like around. It's like the part where the vagina actually, like the cervix appears to almost protrude like a little bit. If it goes too much, that's like a prolapse, right? If the cervix kind of goes down low, that's a prolapse. But in this case, which is another important reason for all the dispensary elements, and then of course it's like forced childbirth that can happen. But that's the lateral fornix should be just a little bit giving that cervix just a little bit more of like a pointed out, almost nose-like structure. Okay, nice. That everybody talked about the ovaries. Oh, ovaries, right? So ovaries, the gonads themselves, egg development. Oh, fembrae, right? So the fembrae, little finger-like projections, ready to grab newly released ovulated eggs. Suspensory ligament, we talked about that. That's also connected to the ovary, is carrying vasculature as well, such as the ovarian artery and the ovarian um, vein. Uterine tube. Ah, yes. Okay, let's talk a little bit more about the uterine tube. So the uterine tube, as we talked about earlier, it had this kind of like got these longitudinal folds in it, right? So there it is. And let's see here. The broad ligament itself, mesometrium, right? So it's still part of the lining. Um, Mesovarium, right here, it's not quite part of the ovary, but it's suspensory. And let's see here, is that everybody else? I think that's it. Talked about the fundus. We talked about, yeah, that's everybody. Okay, great. So we'll look at this in greater detail, but I just kind of wanted to get that mapped out for you. And let's see here. This is not helpful, I think. So this is not helpful. Sort of helpful, I guess. So this is a reproductive tract from a cadaver. So this was excised. It's a little bit difficult to kind of get your head around this, honestly, for most folks. But if it's helpful, here we have the fundus in the body of the uterus. The cervix would be right about here. This would be the vagina in this area. Hopefully this is helping a little bit. So the ovaries are kind of these little protrusions out here. And so this would be like the ampulla and the isthmus. Infundibulum right here with the little fembrae that would be coming down. Suspensory ligaments coming up. The round ligament coming down here. And yeah, so that's it. That's just not really how it looks like in a living individual, but there you go. Right, the uterine tube. So there are major portions. So we talked about the infundibulum, the fembrae, the ampulla, and the isthmus. We'll go into those a little bit more. The infundibulum is, here's the ovary. So let's give fembrae, and then here we go, and then a little bit more, and then a lot thinner, right? Okay, and then like here's, right, uterus down there. Okay, so oops, hey, get back there. Okay, so it's a flared kind of trumpet-ish area right here of the infundibulum of the uterine tube. So over here, little finger-like projections of the fembrae, the ampulla. It's kind of like the middle portion, the kind of long haul part. The isthmus is where it turns sharply and gets like really thin before we enter into the uterus. The mesosalvix is the superior portion of the broad ligament, and it enfolds the uterine tube itself. So it's not really part of it, but it is accessory. The epithelial lining of the uterine tube, as we talked about, has like all these little ciliated cells. Remember cilia out here, kind of to allow flow, ebb and flow in the tube. And that's it. We'll end it on that beautiful photo right there. Okay, so I hope that was helpful. I hope you are all out there somewhere. Have a great day. Bye-bye.